So, buddy, what brings you in today? Is everything okay with your sugars and your insulin?
I think so. I brought my printout.
Oh, okay. Well, here, let's take a look at it. Um, Buddy, these numbers look
Hmm?
great. Look at all of these days that you stayed inside your target range. Good job, bud.
Thanks.
Well, so is everything okay? What brings you in?
Well, I was just wondering about type 2 diabetes.
Oh, okay.
So I know that I have type 1 diabetes, and I know that type 2 is a little bit different, but I don't know why.
Okay, so type 2 diabetes is a little bit different. It's more common in grown-ups. So usually kids like you who have diabetes have type 1 diabetes, but sometimes teenagers or even older kids can get type 2 diabetes.
Oh, so is it autoimmune like mine?
No, it's not autoimmune. It's actually really complicated, and we don't completely understand exactly what causes it. But we do know that there are certain things that make it more likely that you could get it.
Oh, like what?
Well, one of the things is obesity. So that means if you're really overweight for a long time, then that could increase your chances of getting it.
Oh, so do all overweight people get it?
No, it doesn't really work like that. So what it means is that if you're really obese and overweight, then it could increase the chances that you might get type 2 diabetes. But it doesn't mean that you definitely will get it. And people of all different sizes can get type 2 diabetes.
Oh, well, what else?
So another thing is family. So if you have people in your family that have type 2 diabetes, then that could mean that you're at an increased risk of getting it. So that's probably because there's something inside your genes that's causing it.
Oh, well, I'm not wearing any jeans. Ah, but you are!
Oh, well, no, not that kind of genes. This is a different kind of genes. Genes, like in your cells. They have your DNA in them.
Oh, so jeans and obesity. Anything else?
Yeah, so the other thing is just habits that you have. So, like what kinds of foods you eat and how active you are. But it's really complicated. And for most people, it's just a combination of all of these different things. So, we call those different things risk factors.
Risk factors.
Mm-hmm. Risk factors. So, what that means is that there are different factors or things that increase your chances or risk of getting type 2 diabetes. Risk factors.
Risk factors.
Right.
Oh, so do they need insulin?
No. So remember how I said that type 2 diabetes is not autoimmune? It's a little bit different. So for you, you have type 1 diabetes, and that means that your pancreas can't make enough insulin. And so with type 2 diabetes, the pancreas can still make insulin, it's just that it doesn't make enough. And also all of the cells need a little bit more insulin to get the glucose inside them. So people with type 2 diabetes take a different kind of medicine that helps the pancreas to make more insulin and helps the cells to respond a little bit better.
So it's still about the pancreas and insulin.
Right, so it still has to do with the pancreas and insulin, just like yours. And people with type 2 diabetes still have to check food labels, just like you do. And they still have to sometimes measure their blood glucose, just like you do. But the medicine that they take is a little bit different.
Oh, okay. Thanks. Is there a type 3 diabetes?
Well, there's not a type 3 diabetes, but there are other kinds of diabetes. But that's a little bit more complicated, so maybe we should talk about that another time.
Okay.
All right?
Sure. Thanks, Dr. Heather.
Sure, buddy, anytime.